Good morning, everyone. It's Dr. Sal Picella from San Diego, California. Hope everyone's well. I'm joined today, of course, my colleagues, Dr. Sam Rhee from Paramus, New Jersey. He's at Bergen Cosmetic. And Dr. Sam Jajurikar from Dallas, Texas. He's at Sam Jajurikar. I am at San Diego Plastic Surgeon. How are you guys?
Doing great.
Doing amazing.
We have had a hiatus from our usual podcast, Three Plastic Surgeons and a Microphone, and we're happy to pick things back up here and talk about an awesome new topic. All right, so today's topic, we're going to talk about what's hot in the media, Ozempic face. Okay, so these are a new class of weight drugs that a lot of doctors have been prescribing recently, and they've had some interesting side effects. So we're going to talk about those today. But first, before we do that, we're going to give a little disclaimer, our usual disclaimer. This show is not a substitute for professional medical advice, diagnosis, or treatment. This show is for informational purposes only. Treatment and results may vary based upon the circumstances, situation, and medical judgment. After appropriate discussion, always seek the advice of your surgeon or qualified health provider with any questions you may have regarding medical care. Never disregard professional medical advice or delay seeking advice because of something in the show. All right, gents. Well, so I'm going to hand it over to Dr. Jajurikar. He's going to take the lead here and tell us a bit about Ozempic face.
Perfect. Yeah. So much like you guys, over the last 2 weeks, my social media feed has been sort of dominated by this hashtag Ozempic face. I have saw sort of articles in the New York Times. I've seen other plastic surgeons talking about it on their social media feeds. And so I thought this would be a timely topic for us to talk about. So first of all, what are these medications? Ozempic and Wegovy were the first two medications that were sort of released. They're both actually the same medication, semaglutide. And Ozempic was actually released for the treatment of type 2 diabetes. Wegovy, which is a higher dose of semaglutide, was approved for the treatment of obesity. A few months later, like June of 2022, Mounjaro was FDA approved for the treatment of type 2 diabetes. But interestingly enough, as the clinical trials were done, even though Mounjaro is technically for type 2 diabetes, the clinical trials actually show that weight loss with this medication could be twice as much as you might see with these other meds. And so in a lot of cities, Dallas being one of them, I know New York City, I'm sure you guys as well, you're seeing it a lot. A lot of patients started getting this prescribed for their doctors for the treatment of weight loss. And there's just tons of chatter. It's almost like it's magic that's out there. And there, again, Ozempic was sort of the first one that was talked about a lot. Now Mounjaro seems to be the most effective. Before we get any further, I want our patients to know we're not necessarily promoting the use of these medications. There are side effects like there could be with any other medication. The reported ones that they've seen thyroid cancer in rodents with all of these medications. Pancreatitis could be a side effect with these medications. So we are not trying to push these medications. But in the New York Times article that I read earlier this week, they actually said that on Twitter, the hashtag Ozempic face had actually already been referenced 2.3 million times. So a lot of people are actually talking about this. So how do these medications work? Mounjaro, I'm going to talk about that as well as Ozempic. So Mounjaro and Ozempic both work through something called GLP-1 receptors, which are glucagon-like peptide receptors. And they do a few things. The first thing they do is they sort of increase the effects of insulin in your body. So as we get older, or when people have diabetes, they get more resistant to insulin, meaning that their ability to just sort of break down glucose and process it gets worse. So they're more likely to start seeing diabetes. They're more likely to start gaining weight and storing that glucose. So these medications increase the sensitivity of your body to insulin. The second thing they both do is they reduce gastric emptying, meaning you eat a little bit and you get full a lot quicker. And then they both reduce glucagon levels, which means you're less likely to mobilize glucose in your bloodstream. And so all of those medications, Ozempic, Wegovy, and Mounjaro do this. Mounjaro actually does something else. It actually works through another receptor as well, which are called GIP receptors, or glucose-dependent insulinotropic polypeptide receptors. So what it also does, it also works on your brain so you're not hungry. And it increases the sensitivity even more so to insulin. So it's sort of speculated because it's got this dual mechanism of action. That's why it's more effective than Ozempic. So my personal story is this. I come from a family that has a strong history of type 2 diabetes. About a year ago, when I checked my hemoglobin A1C level, which is a marker of diabetes, it came back elevated at 5.6, which is the beginning of prediabetes. So with my doctor, we came up with a regimen of changes to my diet where basically I was having less carbs. I actually started doing intermittent fasting, all in an attempt to control my levels of my glucose levels and to try to control my, propensity for type 2 diabetes. So a year goes by, I actually lose about 12 pounds doing this. I check my hemoglobin A1C again, and it's gone up to 5.9. And so now my doctor is telling me, well, you probably need to start some medication for this. He actually recommended that I start a different medication, a different pill. But because I'd seen so many of my patients on Mounjaro, I actually asked, can I try Mounjaro for a few months? I wouldn't mind losing another 15 or 20 pounds and then transitioning to this, which he agreed to. So I started on Mounjaro about 5 weeks ago. And what happens is in this past 5 weeks, I have actually lost 15 pounds. And it just so turns out that about a year ago, I'd actually taken some photos before I was getting a laser treatment. And so I got another set of photos to see whether I had gotten Ozempic face. So gentlemen, what do you think? Do I have Ozempic face?
I think you look chiseled.
I think you look like The Rock.
Yes. Well,
yes.
so
yes, I do.
Yeah, it's interesting, right? It's interesting. So when we look from these views, I mean, I definitely think I look better, but I also think that the weight loss in my face is disproportionate to a 15-pound weight loss. I think there's a lot. Yes.
Well, so let me say, we see in cancer reconstruction that I do very frequently, we have the benefit of kind of seeing patients over and over throughout several months and over a year, 2 years, et cetera. And we sometimes take pictures of their face, et cetera. And there is some yo-yoing that occurs sometimes with weight. And I would say that, even 5 to 10 pounds of weight loss, you can actually see it in the face, I'm going to say. So it's actually not surprising to me with just 15 pounds that we're seeing, some subtle changes in your face. The big thing that jumps out at me the most, I think your jaw looks great. Go to the oblique for a second here. I mean, your jaw definitely looks more chiseled. Look at the submental area. You don't have any additional fat underneath your chin area here. So you look great. The only thing I see here that I would say may be a little bit treatable is the temporal area right here above, right in between your ears and your eyebrow. That is notoriously a place where I see patients kind of lose weight and sort of have issues related to weight loss. So we got some treatments for that, my friend.
The other comment I would make is I agree with Sal 100%. The only other place I would see any sort of maybe more overt signs of aging is under your eyes a little bit. There's a little bit of hollowing there that honestly, though, for your age and for your weight loss is pretty good. What I'm impressed with is when I see a lot of people who've lost this kind of weight, their nasolabial folds get pretty deep. And I don't see that in you. And I don't know if that's good genes or, you just never really had that to begin with. I'm not sure. But that, honestly, for 15 pounds at your age, your face is holding up pretty well there.
Yeah, looks great.
So this is an interesting one for you guys because normally we'll look at these pictures and they're just some patient you don't know. So it's easier to sort of for you to be a little critical of it. But because it's me and you guys are nice guys, you are being exceptionally kind. So I agree. I think I look healthier having lost weight. I think my face looks more chiseled. I will say a couple of things about my jawline area, Sam, in terms of your comment. I'm kind of a freak about radio frequency treatments. I'm a big believer that radio frequency and retinol treatments together at home can be really beneficial for keeping skin tight. So I think between Morpheus 8 treatments, which I've sort of done regularly over the last year and a half to two, a home form of radiofrequency treatment that I do about once a week, and then being very good about retinol treatments, I think that probably explains what we're seeing with the jawline area a little bit, where it hasn't, I think my jawline actually looks better with weight loss, which is interesting than it did before, because you would expect this area along the lower jawline to get more to get more sagging.
Mm-hmm.
In terms of the nasolabial folds, which are these lines for patients between the nose and the lips, and the marionette lines, which are the lines between the lips and the jawline. I mean, I think there is some deepening that has actually occurred in this spot. These are very treatable by fillers. I agree that I think that I've lost a lot of fat in the orbital region, where if you look at my lower eyelid, it looks substantially more sunken than it did 15 pounds before. I thought the thing which you guys didn't really mention, I thought I lost a lot of my buccal fat, which is another hot topic. You know, a lot of patients will sort of come to us and talk about, you know, do I need my buccal fat pads taken out? They want to get more of that chiseled look. And I was thinking part of the reason why my cheekbones actually look a little bit more defined was I think my buccal fat is gone. Which I don't know if that'll come back if the weight comes back, because, you know, which we didn't mention, a lot of patients on these clinical trials, once they stop Mounjaro and Ozempic, they get a portion of this weight back. So I don't know if my buccal fat will come back. I don't know if my orbital fat will come back. I don't know if my temporal hauling that Dr. Pacello was talking about would come back as well. So I don't know. It's interesting because some of the fat that we lose in our face is just different kinds of fat. They're fat pads than the typical fat that we might see in our abdomen that wavers. So I don't know.
Dr. J, one question for you. Do you smell what the Rock is cooking? It's unbelievable. I mean, what you need to do is you need to shave your head and get a tattoo over your shoulder, and you are a spitting image of the Rock. I mean, it's amazing. So,
if only that were true.
So, all right. So let's talk for a second about, you mentioned fat transfer. I do a tremendous amount of fat transfer in and around the face and the periorbital region. And, the beautiful thing about fat transfer in and around the face is very easy to do, very predictable, and very long-term. This is something you could do right in the office. So that fat that's harvested from the abdomen, though, remembers that it's from the abdomen, right? So anytime you transfer tissue around, if you gain or lose weight after fat transfer, you will see it accordingly in those areas. So as to if you gain weight again, will you see it in your temporal fat pads? My answer to that is probably not. My experience has been that when people lose this in this area, it tends to be permanent. Even when people put weight back on, it's like that's a combination of aging and or weight loss. But it's interesting. One of the only places in the body that once you lose the weight, it's gone and it doesn't come back. It's that area, in my opinion.
Yeah, I agree with that. I feel like buccal fat, temporal fat, and orbital fat, when they go away, they don't come back. And I think you're right. There's a lot of longevity that comes with a fat transfer. And for patients that don't want to do repeated filler treatments, that is a very nice alternative. I am a big fan of doing transient filler treatment as well, because I find that to be predictable as well. And the thing is if my weight yo-yos afterwards, I've definitely seen fat to the temporal region, fat to the cheeks gain weight afterwards once a fat transfer happens, and people's face look abnormally fat as well. So so my personal approach to me, which I'm going to show you guys in a second, is I'm probably going to do some extensive filler treatment in the next few months here to try to overcome some of these changes. Any comments, Sam, before we move on to if let's say I showed up in your office and I said, I want you to help me with some of these signs of aging, what would your approach to me be?
Yeah, my first go-to generally, Sal is right. Fat is an amazing treatment method, and I use it a lot too for the face. But I always usually, for a first-time patient, will start with some sort of filler just to make sure that we know what we're doing in terms of results, whether they like it. And it helps us sort of gauge what a future fat transfer is. So I will usually start with filler and then bridge to fat if it's something they really like.
So I use some virtual aesthetic software in my practice, which is called Chrysalix. The only eerie thing about Chrysalix is that it cuts off your hair. It always looks like sort of a weird looking mask. But I started playing around. I'm like, how can I still sort of maintain this look that hopefully I'll maintain most of the weight loss that's occurred, but how can I reverse some of these signs of aging? And so Chrysalix has a partnership with Allergan, and I do use a lot of Allergan filler products in my practice. So in this, I sort of simulated what I thought 2 syringes of velour would look like in my nasolabial folds and marionette lines, which is a hyaluronic acid filler. I simulated what 2 syringes of Volbella would look like in my lower eyelids and kind of spread a little bit into my temple area. That's a hyaluronic acid filler. I simulated what 2 syringes of Voluma would look like in my cheeks to try to add a little bit of volume to this lid cheek junction. And I even added a little bit of Volux to my jawline, just a little bit, to try to make my jawline even a little bit more rock-like in Dr. Pacella's analogy. And I thought this would still maintain sort of that chiseled look without any substantial downtime. The nice thing about filler is I don't have to have surgery. It's something that can be done in the office, and I can just sort of go back on my way. And so I anticipate doing something like this in the next few months, maybe in a piecemeal manner. You guys have any comments about this?
I think it looks great.
Yeah.
I think it's amazing how I believe this is fairly accurate in terms of simulating what that kind of filler treatment is. What is surprising and yet not surprising is how much filler you had to use to achieve these results on the simulation. Like, how many syringes is that? Is that like 8 or 10 syringes? Like, that's a lot. Like, I
was estimating about 7 syringes of filler altogether to make this happen. Yeah. It's a lot.
Many?
That's the thing, 7 altogether was what I was thinking. 2 of Allure, 2 of Voluma, 2 of Volbella, and the Volux, I don't really know if I need that one. It's just new, so I want to play around with it.
So
for the jaw, that's a jawline filler.
So that's a good point about the amount of syringes. So let's just say on average, syringes of the fillers are $400 to $600, something like that. Would you agree? I mean,
the Voluma is way more expensive than that. Yeah, but
okay,
yeah.
So let's just even.
I'd say between $700 to $1,000 a syringe.
Okay, so let's just do the math real quick. So you have $700 a syringe.
That's about $5,000. Let's just say about $5,000.
Okay.
Yeah.
So $5,000. So fat transfer is relatively inexpensive. Can be done in the office setting. Takes about an hour. And I would say that it's well below the cost of that. And so just to keep this in perspective for patients, when they choose a filler, fillers are temporary, very easy to do. Fat transfer takes a little bit of time, a little bit of recovery, a lot more swelling. But the fillers are a little bit more reversible, a little bit more subtle, etc. So it is a financial issue many times with the cost of fillers, for sure.
Absolutely, but the couple of things I might take issue with what you said is there's a lot of downtime with fat grafting to the face. There tends to be a prolonged amount of swelling that can happen with it. It's not a little bit reversible. I mean, it's not really reversible.
Right, that's what I meant. That's no.
So when you say filler is a little bit more reversible, it is reversible, and fat is not reversible.
Right, I did say that. I did say. Wait. I did say the fillers are more reversible, and I said that there's extended
a little bit more reversible. Yeah, but and then the other thing is, listen,
what? Hold on. Let's give you some correct information. There are ways to treat overfilling of fat. Injection of steroids. There's massage, etc. So I'm just saying the degree of reversibility or change is much more difficult with fat transfer. I agree, but it's not a zero sum, right?
100%. But then the other type of cost that I would talk to you about is an opportunity cost, and you know what that is, and Dr. Reed knows what it is. But for people that don't know what it is, an opportunity cost is that cost that from downtime that which you're going to lose out on. So for me, if I can do filler injection and do it during the course of my day and continue to work and not look abnormal for a couple of weeks or 3 weeks or 4 weeks or however long it takes fat to go away, or the swelling and bruising to go away, I actually think that that's less expensive for me in the long term if I'm not looking abnormal for a period of time and I'm seeing patients and I'm able to continue to operate. So, and I agree. I'm not hating on fat at all. I love fat transfers to the face. I don't tend to do a lot of it in the office setting for this. When I do fat to the temples, when I do fat to the lower eyelids, I do fractionated fat, fractifat, which it's just easy, and so there's just lots of preparation. So I tend to do this in the operating room when I'm doing it. So, there's pros and cons to either approach, but it's not uncommon for me in my practice to do 4 to 6 syringes on people at a given session. I mean, I probably do that on a weekly basis for people that have needs. So to me, that's not an abnormal amount of filler product to use.
I love this debate between you two because I think for certain patients, fat is definitely their answer, and for some people, fillers or both sometimes. And so I feel like the fact that we can have a good debate about both shows that there's utility in both methods of approach, and it's something that you discuss with your surgeon, and then you sort of figure out what probably would work best for you.
Yeah, so I think the take-home message, at least in my mind, the two questions are: is Ozempic face a real thing? Yeah, I think it is. I do think you definitely see signs of facial aging with it. Is it unique to Ozempic, or is it more just related to weight loss? Who knows? But is it treatable? Yes, it's treatable. There's great ways to add volume back to the face. So for me, I'm personally very happy that I've been taking Mounjaro. I love the fact that over a few weeks, I've lost kind of a ridiculous amount of weight, and then I'm motivated to keep it off afterwards. We'll see if I'm actually successful. So
I think the other key to remember is that you did a lot of non-invasive skin treatments during this time, which can be very helpful. So people should sort of keep that in mind as well as they're going through this medication regimen, that maybe they should also be focusing on that as well to help themselves.
Great.
Well, gents, that's a great place to end, I think. I mean, I think the key here is we're going to be seeing much more of this in the future as surgeons, and good to know there's a lot of treatments for that. I'm going to leave you with this. Know your role.
Peace out, everyone.
All right.